So if I want, did you start?
Yep, we're live.
Okay.
Yes.
All right.
Welcome everyone. Thanks for joining us again here today. I'm here with Karen Wilson, and we're going to talk a little bit about upper back pain and tension, and this definitely relates to me, so I'm super excited for this topic. We're going to make sure we share this to our preferred page, so give us a few seconds while we do that, and then we'll get started. So, did you get it, Rach? Good deal.
Okay. We're going.
Okay, I think we're going to go ahead and get started because you've got to coach some t-ball tonight, right?
I do.
I love it.
That I do.
Yes, so speaking from my own personal experience, I used to work in retail and I was on my feet every day, so I never suffered from the desk crunch is what I like to call it. But I think upper back pain and tension is something that definitely affects my life and my day-to-day activities, and I definitely bring it home with me. So what can you tell me about this ailment, and is it something that's fairly common? Thanks, Rach.
Yes, it is very common. We have a lot of patients that we see, and just because we're such a forward society, meaning that we are very techie. We are always on our computer, we're always on our cell phone every day, so we are in a forward posture. And what happens is our neck ends up being forward as well. Shoulders are forward, neck's forward, and then we end up putting our back and our neck basically in a compromised position. So with that, we can do a lot in physical therapy with that. We will do an evaluation to determine exactly what's going on. Just because you have upper back tension or pain doesn't mean it's coming from the upper back. There may be other causes.
Oh, nice.
So,
well, lots of problems, right?
yes.
Well, thanks you all for joining us. Looks like we've got a few viewers now. We're going to talk a little bit about upper back pain and tension, and Karen just kind of explained how you would go through an evaluation to kind of determine the root cause of whatever is causing that pain, whether that be, sitting at your desk, or maybe you're down looking at your phone or anything like that. So, hi Sarah, how's it going? So, during an evaluation, what sort of things would we be looking for?
So when we do an evaluation, we would look at the top all the way down. So if it's your upper back, we would look at the joints above it and below it. So we would look at the neck and the lower back.
Okay.
We would look at range of motion. We would see how your motion is. We would do resistive testing, meaning test how strong your muscles are, and make sure everything is good there. And we'd also look at how far you can go passively in the range. So in that regard, what we're looking for is specific. Make sure that passive is a little bit more than your active range, and make sure that you have good manual muscle testing, meaning that your muscles are strong.
Right.
So in that regard, we make sure that there's no cervical or neck component to the pain, or no thoracic component to the pain, that the nerves are intact. That's really what we're looking for. We're trying to rule out all the bad things.
Right.
So we're trying to rule out any sort of neurological issue or maybe some vascular compromise, and make sure that we're good to go. So
right. Would the length of treatment vary? Obviously if there was an underlying root issue versus just trying to stretch out those muscles, or...
Yeah, and I think it depends. It depends on the patient. It depends on how long you've had the pain. So if the pain has been there for an extended period of time, it's going to take a little bit longer to strengthen the muscles that have become weak because of that forward flex posture. And if it is a neurological issue or a vascular issue, there are some red flags that we look for as therapists in the evaluation, and we monitor that throughout the treatment program as well. But we want to make sure that there are no red flags. If there are red flags, we call your physician. But what I mean by red flags is if there is, we think that there's some sort of a vascular compromise or a blood flow issue, or there's a nerve issue that may be causing the problem.
Definitely. Well, I tell you what, I feel like I personally have, I've injured my back before, so sometimes I wonder if it's not something else that's causing it, but I'm not the only one who obviously has these issues.
Yeah,
on average, how many patients? Is it something fairly common that you see?
It's very common. It is very common. We see it a lot. And honestly, anyone that's in a position where you sit at your desk, or you're working or interacting with other people, physical therapists, people in healthcare, people that have desk jobs, like I said, anyone that is in a seated posture or is bending over people or bending over doing things, any sort of, if you're on the line and you're working on parts or putting parts together, that's another issue, because a lot of times your position is compromised, so you can't bend your knees and use good body mechanics in those instances.
Yeah,
so.
Absolutely. Looks like we've got a few viewers. I just want to say welcome, everyone. We are talking about upper back pain and tension, and how that can affect your life, and what we can do to help you move past that and kind of move forward. So Whitney says, what are some easy at-home exercises that I can do to relieve my upper back pain? So maybe we should walk through the evaluation, and then what that looks like, and then what sort of things we can do at home to...
Absolutely. So like I was saying before, we would go through a full evaluation and do a scan. We would observe you and Whitney. We would see how your posture is in standing, how your posture is in sitting, if your head's forward, if your shoulders are forward, if one shoulder's lower than the other. We would assess all those things first. Most of the time, we don't even put our hands on you to determine what's going on at the joint level or what the muscles look like until we have observed.
Right.
We watch the shoulder blades. We see how those are moving. A lot of times when people have upper back tension and pain or neck pain, what happens is our shoulder blades are really, really weak because we've been in that forward flexed position, and those back muscles they're in a lengthened position and they can't work right in that position. So we would assess all of that, and we would rule out any sort of other issues. And once we've ruled out all that, we basically assess, like I said before, your strength, and we'd assess your posture and make sure that those are intact and you're good there. And from that point forward, we would move forward with the other part of the testing.
Sure. So what sort of tests go into this ailment afterwards? I mean, I guess it varies based on what sort of, what's the root cause of what the problem is.
So if we think that maybe there's a joint that's not moving well, what we'll do is we'll put pressure on the head and make sure that you don't have pain with those movements, and make sure it doesn't reproduce any neck pain or back pain or arm pain. You can actually have some cervical disc issues, some neck disc issues, and you can have scapular or shoulder blade pain first, tension and pain or spasm in those muscles, and that can be actually a disc issue from the neck. So we want to make sure that when you come in that you're not just having tension in the neck, make sure that those things are absolutely ruled out. And then if they are, then we move forward with testing other body parts. We make sure that your core is strong. We make sure the shoulder blades are strong. And that's really important. Posture is very important in how you feel every day. So back to Whitney's original question is we want to make sure, Whitney, that your posture is good when you're sitting at work. So what we could do is we could do an ergonomics evaluation. So we could have you take pictures of, or have you set up your computer or desk situation at the office. And I do that a lot. We do that a lot with patients every day. We say, okay, sit in this chair, show me where your computer is, show me where your phone is, and make sure that everything is where it needs to be.
So you're not straining.
Yeah, so you're not straining. And most people don't think about their computer screen and where that needs to be. So your computer screen needs to be a couple inches below your eye level. The top of that needs to be a couple inches below your eye level. So a lot of people, their computer is either too low or it's too high. So we need to prop it up if it's too low, so you're not straining. Because if you're straining, you're going to be here in this bad position, and then you're going to end up with some neck issues too. It usually just works its way up or down the chain at that point.
How many of you are sitting at your desk right now, evaluating your current desk issues? We can fix that.
Yes.
We treat that, right?
We do.
Definitely. So what is after that? What is an average visit look like after your initial eval?
So after the initial evaluation, we usually spend between 45 minutes to 50 minutes with you, hands-on, and what we'll do is we will assess the joints and make sure your joints are moving well in your neck and your upper back, and then we will put you in different positions to basically stretch out the muscles that need to be stretched. A lot of times the pecs are really tight here in the front, and we'll put you in a position a lot of times on your back on a foam roller in positions like that. And those are really, really good exercises. I tell all my patients that are having upper back pain, if they can tolerate laying on a foam roller, that's a really good way to combat the forward positioning that we have every day. So
Definitely.
it's
And it's something you can do at home,
Yeah,
too.
it's
so
great. It's
you
great.
can do those exercises at home, like Whitney was asking, too. So
it'd be a great one to do at home.
Yeah.
But again, I wouldn't give anyone a home exercise program like that until I've made sure that I have ruled it out. So I would recommend that you see your physical therapist and come see us, because we treat that.
Definitely. Courtney would like to know, at what point with upper back pain should I seek physical therapy? I think a lot of people think it's just something that comes with the job. That's certainly what I thought. I, was making other calls, like calling my optometrist, because I'm like, well, my eyes hurt and I have headaches. But really, I think it was a root cause down in my shoulders and my back.
Right.
So when is it time?
I think when it's time is when it starts to impede your function. So when you're having pain on a consistent basis, whether it be weekly or every other day or a couple times a month, you probably need to evaluate your situation that you're in, Courtney, and make sure that your workstation is set up correctly, and make sure that you're sitting with good posture. Most of the time we want you with your feet flat on the ground, your knees and your hips in a 90-degree angle when you're sitting. A lot of people are in this position, or they're forward like this, again, which
crossing
their legs, which doesn't set you up for success.
Right.
Yeah.
Do you have any tips for retraining your posture?
Yeah, I do, actually. And if you'll be my model, I'll
sure
show
thing.
you. Sure. A couple things that we look at is we want to make sure that Regan is sitting all the way back in the chair. Okay. So when she is sitting at her desk, we want her all the way back in the chair. And if she can't get back and get her feet flat on the ground, then we'll prop something up underneath her feet.
Yeah.
So we'll make sure we do that. We want to make sure that your back is supported. So if your bottom, if you think about this, if your lower back is supported in your chair here, your upper back is going to be automatically supported. And your neck is going to be over your shoulders, and your shoulders are going to be over your hips. If you're even an inch forward in your chair, so go ahead and slide forward an inch in your chair and then sit back. See what she did? She automatically rounded her shoulders out. So pecs get tight. What happens there? She's going to end up, if she has a computer screen or
crouching
phone
over
in front of her, she's going to be forward in the chin and forward here, which sets her up for other issues in the neck. So we just want to make sure, first of all, the biggest thing is making sure your bottom is as far back in the chair as you can get it. So once your bottom is as far back, everyone, you should get your bottom back in your chair. But really, it's we have to tell ourselves that every day. We do this day in and day out, and I have to remind myself of that every day. But that's a huge part of it, is just where you are in your chair and how you're sitting.
Well, and there are some, like, you can get those things that wrap around your chair, to help support your lower back.
Absolutely, and you can get a lumbar support. Some chairs have lumbar supports. You can even take a small, like, hand towel, a rolled up towel, roll it up, put it behind your back, and I usually say duct tape it or tape it up and put it back there. That way it doesn't fall apart, and all you have to do is grab it and put it back there, just so you're in a better position. You don't want a big towel, but I'm talking pretty small.
Like a pool noodle.
Yeah, like a towel roll like that, just so you're in a better position. Your life will be a lot better if you're more upright.
Definitely. Hi, Jeremy. I think that there are a lot of people out there who are definitely suffering from these sort of things, and so what advice would you give to them to help them make that step to call a PT?
So I would start by looking at your workstation and looking at what you're doing every day. And if you're forward, if you're in that position and you're having some pain, you need to contact either your friend that's a physical therapist or contact us, and we'll get you in for an evaluation. It is posture that leads to problems later in life, and I didn't used to think that. I knew that, but I didn't used to think that until I saw it happen day in and day out with my patients and myself. So the more forward you are, the worse off you're going to be. So do it now versus wait.
Right. Well, we've got just a few minutes left. If you've got any further questions, be sure to drop them below in the comment box, or if you're watching the replay, feel free to drop those comments below and we'll follow up with you later. Just to kind of recap what we've talked about, upper back pain and tension is something that's incredibly common, it seems like.
It is very common.
And it's treatable.
It is treatable.
So you don't have to live with it, and it's seems like, there could be an underlying cause or factors in that, but it is something that we can treat, and we will help you get back on track with whatever things you need, whether that be your workplace or
Right.
Anything.
And one more plug for this, in terms of exercise is super important, not only for stress level, but it's also important to strengthen the muscles that tend to be weak when we sit or when we're forward. So exercise is very important and should be incorporated daily, if not 4 to 5 times a week for all of us,
Right.
honestly. But going to physical therapy is a good way to jumpstart that, and it's a good way to get in a good habit of having good posture as well as exercising on a daily basis, because we will give you exercises and we'll teach you better mechanics.
Definitely. Awesome. Well, thank you so
You're
much,
welcome.
Karen, and
You're
thanks
welcome.
to everyone who watched, and we look forward to seeing you next week on Tuesday when we talk about our next topic.
Awesome.
All right.
Thanks for
you.
tuning in.
Thanks.